and see how much protein you're getting, because most people, they're not getting nearly as much as they think. Dr. Williams, what's one small step someone could take today to kind of get ahead of preventable health issues?
I mean, you can take ownership of your health, and it's never too late to start at any point. I mean, I've seen people really turn it around in just 6 months and even in a year. So that's kind of my message.
Yeah, love that. Hey guys, my name's Ken Clark, owner of Purpose Physical Therapy and host of the St. Pete Professional Spotlight Series. Back with another episode, I am joined by Dr. Luke Williams. Dr. Williams is a board-certified internal medicine physician with a unique approach to primary care, one that brings the focus back to you. Dr. Williams believes that medicine works best when the doctor-patient relationship is strong, personal, and not rushed. That's why his MDVIP affiliated practice offers something rare in healthcare today. That's more time, more access, and more depth. With over a decade of experience in both primary care and emergency medicine across Pinellas County, Dr. Williams is recognized for going beyond just checklists and writing prescriptions. He partners with patients on a range of topics, including nutrition and fitness, men's health, heart disease prevention, and sleep optimization. Whether he's reviewing labs, adjusting lifestyle plans, or helping someone just feel confident with aging well, Dr. Williams is grounded in one core belief. It's never too late to take your health seriously, but the earlier you start, the better your odds are of thriving. If you've ever wished for a doctor who knows you, coaches you, and cares enough to spend real time with you, this is a conversation you don't want to miss. Welcome, Dr. Luke Williams. Thank you so much for joining. So happy to have you on. So how's it going?
It's going well. That was a very nice introduction.
I'd love to learn and have the audience and anybody that listens learn a little bit more about who you are, your story, and what inspired you to become a primary care physician and, eventually move towards a more personalized model of care that you currently have.
Sure. Yeah. So I kind of grew up in South Georgia, and I guess access to medical care was a little difficult. So the physicians in town, the surgeons, the family medicine doctors, internal medicine doctors, I mean, they had to see everybody. So they were not just your physicians, they were your friends. You saw them at church. I mean, they really became somebody in the community who we trust, right? So for me, seeing that growing up, and they had a lot of influence over my life, is something that I wanted to do, obviously, to help people and to go into medicine. I didn't know my whole story was going to be like this, but definitely the backbone of it. And there's a lot of good mentors in my life that have guided me to this point.
Awesome. What else drives your passion for this preventative side of medicine?
So the preventative side, I just think because we see so much, whether it's blood pressure issues or diabetes issues or weight issues, being overweight, and a lot of things can be preventive, like in a long-term sense with weight loss, with diet, with exercise, things like that. A lot of times as providers, we just don't have time to talk to patients about it, as you know. So, but with this style of model that I practice, which is for the patient and physician, it's a really nice model, but we really can dive deep into that and not just giving somebody a diet and say, here, just do this. I mean, it's not a one size fits all for these patients. So, but it's nice to really kind of get in depth with these kind of conversations.
Yeah, absolutely. And we'll definitely get into more kind of what your model looks like and how that differs a little bit. But, growing up in Georgia, you mentioned, right?
Yep.
Is there any sort of values or beliefs that you've kind of taken with you into adulthood, into your practice, and your approach to medicine?
I mean, obviously your family values and, the people that, have influenced me and in medicine, especially. I mean, I've had, a mentor, his name's Dr. Grimsley. So I have to give him, he's like the internal medicine guru in the state of Georgia, and just his wealth of knowledge, how he carried himself, how people respected him. as
Mhm.
a leader in the medical field had a big influence on me and a lot of the residents at the time. And so I can say, there's people obviously in your life that have guided you, but you have these mentors that take it to another level as far as not just
Yeah.
how you practice, but how we carry ourselves.
Yeah, absolutely. I love that. Is now, Dr. Williams, is there any patient story, obviously, without sharing personal health information, any patient story that really sticks out to you? That's whether they've changed their lifestyle or something that you've done that's made a lasting difference in their life.
I think it's hard to, obviously we can't divulge, detail, but I think
Yeah.
overall is I know we've helped a lot of patients by the comments they give us, by like the
Yeah.
time that we spend with them, that I get to spend with them, and even our staff and how we are able to like bend over backwards and help these patients. Whether it's schedule an appointment or they need to get in quickly to see me, or hey, we're
Mhm.
traveling, we need this, or hey, can you even talk to me? So I think it's just a lot of different ways that we're kind of involved in their lives on almost a day-to-day basis at some level.
Yeah, yeah, absolutely. So let's talk a little bit more about your philosophy and the setting that you practice in. I'd love to learn a little bit more for myself, not just the listeners, about uh, how you operate your practice, especially under MDVIP sort of affiliated practice. What does that look like, and how does that differ maybe from traditional primary care medicine?
Sure. So it's a membership-based model, and
Uh-huh.
this is MDVIP is a national company. So we're
Sure.
affiliated as a group of us. I think approximately 2,000 physicians. So
Okay.
So what it does is instead of, a primary care physician seeing thousands of patients or whatever their patient panel is and, very short rush visits, I get to care for a much smaller group of patients, so
Mm.
you get more time, more
Yeah.
attention and better access. So
Mhm.
from my point, excuse me, it's just being proactive. And then when you're proactive, you begin, you're more personal with their care. So, and then, which then again, it allows me to, focus on prevention medicine, longevity, and just adding, value to the patient's lives. So,
Mhm.
and to me, it's just a nice way to practice medicine, and I know our patients, they enjoy it. So,
Yeah, absolutely. And I know we share a couple of mutual patients, and they've had nothing but great things to say about you, which is one of the reasons why I wanted to meet you and get you on and talk with you as well. So I know you mentioned prevention a lot, and that's a big part of your practice and a big part of ours as well. I mean, um, it's more of like it's medicine is more reactive than it is proactive. So what are a few areas where lifestyle changes can really move the needle in somebody's health or life?
Well, I mean, if you're talking about longevity, I mean, I think of all the data markers that we have, I think the number one thing is it comes back to like exercise, and then as you get older, I taught a lot of my patients about strength training, and I'm sure you do too, and
Sure.
mobility and balance and things like that. I mean, but like all of the data points kind of point to not just like your strength, but like you're training with it. So and being able to do this, prolong your life, 10
Yeah.
years, 20 years, X amount of years by maintaining that. So, I think my personal opinion is I think we've done a good job talking about getting your steps in, and all that, which
Yeah.
is good. It's part of
Yep.
cardiovascular health. But a lot of the bigger picture is really, to me, focusing on strength training and balance and mobility as you get older.
Hmm. Definitely. And with that being said, that's obviously clearly important. How do you collaborate with other specialists, whether that's cardiologists, orthopedists, or even physical therapists?
Yeah, so that's a great question. I think my background in emergency medicine has allowed me to get to know a lot of the specialists,
Hmm.
not just on a professional level, but also personally. So for me, it's just all about communication, which is nice. So if you go see a cardiologist, a urologist, an
Yeah.
orthopedic, a lot of times I already have a relationship with them. So it's easy for
Mhm.
me, which I think is a big deal. It's easy for me to just pick up the phone or text them and say, hey, what's going on with this patient? Or what do you think? Or hey, even can you get them in? I mean, I'm
Yeah.
sure sometimes I bother them, but they'll get my patients in. They'll try to get them in, fairly quickly, which is a nice thing. But I think just being able to like, it's almost like continuity of care. So they see me. and then maybe next week they see the cardiologist, but hey, the cardiologist picks up the phone and say, hey, this is what I'm thinking about what's going on with your patient. This is what I think we're going to do, which, just kind of keeps everybody in the loop. I mean, I kind of look at it like I'm the quarterback of the patient's, medicine. So, my
Mhm.
job is to make sure, the specialists are the wide receivers, and, you have all this kind of team around you, but it really takes a
Yeah,
team to keep somebody healthy, in
100%.
a positive way for a long time. So.
Yeah, absolutely. And what do you think, people often misunderstand about primary care or concierge style medicine? Now you talked about that. And then a follow-up question is, can you talk a little bit more about anybody that's listening that might be kind of confused on, hey, what does a membership-based model look like? Do you take insurance and that sort of thing?
So we do take insurance. All right.
Mhm.
It's required actually. You can't opt out of Medicare. There are actually Medicare laws that you can't opt out of. So, and
Mhm.
if you do, you kind of go into a different model, a system that I don't practice, but it's actually more of a cash-based thing.
Right.
But traditionally, for us, being with MDVIP, we have this executive physical that we offer every year. We have Cleveland Heart Labs. We bring you in, we do an EKG, we do vision tests, we do hearing tests, we do walking tests, we do grip strength. And then we do, in-body composition analysis, percent body fat, BMI, and then we kind of, take, hour, 2 hour long visit, and we kind of go over everything. We do this once a year. And then after that, it's really seeing the patients, whatever they need, whether it's 3 months, 6 months, whatever they need, and kind of just being available for them when they need us. As opposed to the traditional side, I just think you're just you're just kind of plugged in. It's not, those doctors are good too.
Sure.
We need those as well. You need
Mhm.
everybody in the community to help, so, but I just think there is a burnout rate. And, there's with some of these doctors, and they get, seeing so many patients that, there's just no way. I can tell you, there's just no way to remember or to keep up with the volume of patients that they have
Right.
to see. It's very difficult. It's very
Yeah.
difficult. So,
Yeah, that's a lot. So,
yeah,
so your model allows you to really kind of scale down in that sense to also spend more time within that actual appointment, correct? Just
that's
you
correct.
got to
Yeah.
get to know them a little bit too.
Yeah. Yeah.
Awesome.
And then if they need, let's say, I order some, they need follow up. I mean, we'll bring them in next week, the week after, or even a few days. So, and I get, and also being a part of the concierge membership, I get texts in the morning, or, the 6 a.m. texts, or on the weekend if something's come up. But the truth is, I don't really mind, I mean, it's, to
Yeah,
me, you actually know them personally. So
sure.
it's just a different feel, like, hey, I want to help this person out, so.
Hmm. Yeah, totally. So, what types of what do you most commonly see in your clinic? It's just probably a range of things, I'm sure, but anything that really you see pretty often.
I mean, obviously, when it comes to primary care, prevention things, you want to make sure people, mammograms, colonoscopy,
Hmm.
are they up to date on their vaccinations? Even pap smear. I mean, we go through everything, right? So, and all their screening. So that's the first thing that comes to mind. And then the second thing, like with the problems, whether they're a diabetic, they have high blood pressure, thyroid problems, depression, anxiety. So you kind of get into that as well. So it's kind of like, it's twofold. It's the prevention. It's also what's going on with them actively, at that time. So.
Hmm. Yeah, absolutely. And Dr. Williams, what would you say are some consequences that you've seen people when they maybe delay care, especially around chronic conditions or even just screenings?
Well, I mean, I can say, with this style of practice, a lot of patients, they're willing to pay this fee. They're definitely more proactive about their health. So, I mean,
Mm-hmm.
there's no question, there's data that backs it up that, that this style of medicine, people are generally healthier. I don't know if it's just, it's not because it's some great doctor, but people are just more proactive about their care, So,
Yeah.
but for me, seeing a diabetic, they're on insulin or they're coming off insulin, or, we bring their A1C down, or their cholesterol down, or their blood pressure down, or even, through diet and exercise, they come off some of these medications, and
Hmm.
so I think a lot of people, when they see, they lose this weight, or they're eating better, like when they don't have to be on a blood pressure medicine, or they don't have to be on this statin or whatever, you know what I mean? So
Mhm.
I think for them, and they see this stuff because they follow up with me so much, they're happy about, kind of the care they're getting, so,
Yeah, yeah,
and how
totally.
they feel. So,
Yeah, and I know you work with people a lot on the fitness, exercise, and nutrition side. Other than just maybe partnering with like a nutritionist or dietitian, I don't know if you refer in that direction or not, but what does that look like for you with a patient when you're going through maybe a nutrition program? Do you recommend certain types of diets or even certain supplements, and do you
so
monitor that with?
that's a great point. So, everybody's different, right? Everybody,
Yeah.
it's more the art of medicine. Everybody's body responds differently to and some people prefer a diet. Some people want to be on the keto diet. Some people do the intermittent fasting. But I try to talk to them about a diet that I think will work for them, or at least they'll stick with, right? So if you do a lot of times these extreme diets, you'll lose the weight pretty quick, but you'll put it back on pretty quick because you won't maintain it, right? You're not going to continue to do that for the next, X amount of years. So we try to find a happy medium and what that looks like. I'm
Yeah.
a big protein guy, keeping up, zero point 0.8, grams to 1 gram per
Hmm.
pound, which is a lot of protein. So we talk about keeping a good protein in your diet. Also, like creatine, like 5 grams of creatine every single day.
Yeah.
Things like that. We kind of review all that with the patient, and a lot of times, to be honest with you, the patients don't even know. Like they don't, and especially with a protein, they don't even realize like how much they're not getting until we kind of and we kind of dive into it. Like, what are you eating? Like, what
Yeah.
does that look like? And then they're not even getting 20% of their diet.
Yeah.
But you get it kind of. So I don't know. There's not one diet I subscribe
Hmm.
to. I just said, hey, let's talk about what can work good for that patient. So
Yeah, yeah, totally get that. Yeah, I do the same thing with even my patients. It's, within our scope, we talk about dieting and nutrition,
right,
and I say, yeah, you like do an audit on your diet and see how much protein you're getting, because most people, they're not getting nearly as much as they think. And
yeah,
so, yeah,
yeah.
I'm the same way. I definitely emphasize getting enough of that protein.
And when we bring them in for that executive physical, so to speak, and we sit down, I sit down and talk with them, and we kind of like really go through it. And I think they're generally surprised, like, hey, I really don't do that. I'm really
Yeah,
don't get that at all,
yeah,
So, and then even adding, taking the next step, like, all right, you're getting the protein, you're exercising, like adding the creatine, the 5 grams a day of that,
yeah,
it's very simple. There's only really like one brand out there. They have different types of it, but generally speaking, creatine's been around forever. So, it's just something easy they can add to that. So
yeah.
it's
Can you
just trying
talk?
to take the next level of, your health to the next level.
Yeah, yeah. So now, since you're on this point, can you talk a little bit about some of the benefits of creatine? Because a lot of people hear it and they're like, "Ah, no, I don't need it. It's makes me bulky, or I'm not lifting weights." But I know it's one of the oldest,
Yeah.
most well-studied supplements with so many benefits other than just building muscle. Can you talk about some of those
Yeah,
for
I mean,
listeners?
obviously, it used to be the thought was, weight lift is just for like weightlifters, like heavy
Yeah.
bodybuilders, right? So, but they obviously found out, through many studies, like you were talking about, it's been around forever, that it's good. Obviously, it maintains, like, it just doesn't need to be for bodybuilders. It needs
Hmm.
anybody that's like, working out, lifting, you and we should be taking this every day to maintain our muscle mass and muscle health. But then they found other benefits like brain health and
Yeah.
long-term longevity and things like that. So, like life longevity and how you live and things. So for me, the benefits, 5 grams, that's kind of the magic number. Basically, one scoop, very simple
Uh-huh.
for everybody to do. So, but it goes along with, hey, you should be working out, you should be weight training, you should be doing some balanced stuff. And
Yeah.
the truth is about all that is you and I should probably, patients as well, should be doing it every day. You don't really need an off day. Your muscles
Okay.
don't really need that kind of recovery. I
That's
mean,
good to know.
unless you're training at Olympic level, like when you're training, but I'm talking about the average, very average person
Sure.
doing some kind of weight training every day it would be good. I mean, most people try to do 3 days a week, and I get it, but you're
Yeah.
not, your muscle really can recover in 24 hours. You
Sure.
don't,
Yeah.
unless you're on, like I said, a level that most people aren't on. So
Yeah.
elite
And
athletes.
is that the same? Would you say that the studies are pretty consistent from male to female? Is there any differences as far as intake with creatine?
That's a good question. I recommend 5 grams all the time, but I will
Okay.
say, generally speaking, muscle mass and weight training obviously predict, kind of prevents osteoporosis and osteopenia and things like that, bone loss. So
Mhm.
it's protective of all that. So, but when you hit 70 years old, I tell our patients your muscle mass is going to fall like a rock. So
Yeah.
there's no
Yeah.
question when you hit 70, it's just going to drop. So
Mhm.
what do you do about it? You got to start training now. So when you're 60, 65, really before that, but people kind of get into it. They realize like, hey, they tell me, hey, I've lost muscle mass. I've lost this. I can't do what I used to do. So,
Yeah. Yeah.
and I say, hey, all right, think about in 10 years, what's that going to look like? So,
Right. Yeah. No, I think that's super important and helpful information. So I'm glad we were able to talk about that. And I have just a question personally, because I'm curious. I would love to know, since I have you here, what are your thoughts on just cholesterol in general? So when you're reading labs and stuff, is there a certain point where you get concerned? Obviously, I know probably age matters and comorbidities and things like that. But can you talk a little bit about that? Is how concerned should somebody like me, I'm 34, that might have some higher levels of cholesterol? Should I be
yeah.
more concerned, or when should I kind of look towards, or when would you recommend getting on something like a statin or changing diet or anything like that?
Yeah, so this is kind of a hot topic. I mean, obviously, it depends on your age and comorbidities and things like that, and your cholesterol. And sometimes
Mhm.
we measure something now called apolipoprotein B, which is kind of like
Yeah.
it's a newer term, so to speak. I mean, it's kind of like the LDL, and this is what we talk about now. So that's kind of measures all your dangerous cholesterol in your body. So we really, cholesterol to me, or, your body and things like that, it's like a twofold thing. It deals with cholesterol and it deals with chronic inflammation. So you want to keep both of those low. So what do we do it? So a lot of times, how do we do that? So if it's, your LDL or your cholesterol's out of control, we put you on a statin. But I have to admit, a lot of the patients are well read, and we get some pushback about the statins. Muscle
Yeah.
cramping. There's even one fringe, report that it, may have caused some memory things, which has kind of been
Mm.
debunked, but there are concerns about it. So I try to take all that into consideration before
Yeah.
starting a patient on just a medication. Here, just take it. I'll see you later. So
Mhm.
what can we do to maybe change that? Whether it's your diet or exercise, things that we've talked about. So,
Mhm. Yeah.
but there are many different treatments. I will say that out there besides the
Okay.
statin medication. So.
Sure. Yeah, that's great. Good information. Dr. Williams, what's one small step someone could take today to kind of get ahead of preventable health issues, even if they're not ready to kind of book an appointment or anything like that yet?
One small step, there's always three things in my mind,
Hmm.
longevity speaking and health speaking. And to me, it comes down to sleep, comes down to exercise and diet. Sleep doesn't get talked about enough, but sleep
I agree.
hygiene and, going to bed at, normally about the same time, waking up generally the same time. You
Hmm.
should optimal sleep's like 68 degrees, which I know in the state of Florida, our electric bills would be crazy high. Kind of the blacked out kind of room, very dark room, all of those things are, so for me, just something easy somebody could start doing is, hey, no screen time hour before bed. Where you
Yeah.
basically only use your bedroom for sleep and sex, and that's it. And
Yeah.
then
Yeah.
really you shouldn't be in there until you go to sleep. So things like that. And so you got sleep, and then obviously, diet and exercise, which we talked about. So
Totally. Yeah. Those are three things that we easily controllable that
right. Yep.
everybody can start with right now. So love that. Any other kind of a last piece of advice, if you will, or anything that you would say to somebody who might be putting off their health, whether they're too busy or anxious? What would you say to them?
Yeah, I would say don't put it off. I mean, think
Mhm.
about longevity and where you want to be at, in 10 years. If you're 50, where you're going to be at when you're 60. If you're 60, where you're going to be at when you're 70. And I try to
Mhm.
take things in 10-year markers. And, it's never too late to start getting serious about it. It's never too late to start,
Yeah.
I mean, you don't necessarily have to go to, the best doctor, see the best person. I mean, you can take ownership of your health, and it's never too
Mhm.
late to start at any point. I mean, I've seen people really turn it around in just 6 months and even in a year. So that's kind of my message.
Yeah. Love that. Totally agree. Awesome. I don't want to take too much more of your time, Dr. Wins. I know you got to get going and see patients. So I just want to quickly ask for those listening too, what's the best way for someone to connect with your practice if they are interested in learning more?
Yeah, I mean, they can always, Google me, research, call the office. I'm sure you'll have it on this podcast. Call the office
Yep.
number, and even if they want to do a meet and greet, we can always sit down like this and kind of go over some of their medical history. We try to make it as comfortable and easy as for people want to get in touch with me, and it's very simple. Just call the office and we'll get you in. So
Awesome. Yeah. And I'll definitely make sure that posting all that information and sharing it so people can find you. So, Dr. Williams, thank you so much for joining the show. It's been
thank
a
you,
pleasure
Ken.
speaking with you and learning a lot about yourself and your practice. And I hope that we can do this again sometime. So thank you.
Yeah,
Thank you so
thank
much.
you. I appreciate what you do. Thank you.